Diabetes affects 3 million people in the UK, and a staggering 850,000 people with type 2 diabetes go undiagnosed. I'm here with Dr. Sheila McCorkindale, GP in Salford, who's going to answer some important questions about diabetes. So Sheila, what is diabetes?
Diabetes is a common lifelong condition in which the level of glucose in your blood is too high. That's because of a problem with a hormone called insulin. Insulin is responsible for moving the glucose from your blood into cells, where it's used as a fuel to give us energy, to allow us to work and play and live our everyday lives. In diabetes then, glucose isn't used properly and it builds up in the blood, and it's this high level of glucose in the blood that causes damage and leads on to the complications of diabetes.
So are there different types of diabetes?
Yes, and there are two main types, type 1 and type 2. Type 2 diabetes is more common and occurs in about 9 out of 10 people with diabetes. Type 1 diabetes tends to occur in younger people under the age of 40 and particularly in children. It happens because the body can't produce any insulin, and so treatment is with insulin either by injection or by a pump on a daily basis.
So what are the symptoms of diabetes?
The main symptoms of diabetes include feeling very thirsty, passing a lot of urine, feeling tired, perhaps losing weight, sometimes having blurred vision, and getting recurrent infections such as thrush or wounds not healing properly.
So for people developing diabetes, are the symptoms always the same?
Well, these are the symptoms to watch out for. But in type 1 diabetes, symptoms usually are very obvious and come on quite quickly over a period of just a few weeks. Children in particular can become very ill very quickly. And so as a parent, if you think your child has any of these symptoms, it's important to go and see your doctor urgently. However, in type 2 diabetes, the condition develops perhaps over a few years. The symptoms are less obvious, and in fact some people don't have any symptoms at all, and diabetes is only picked up at a routine checkup. Unfortunately, some of the people with type 2 diabetes already have complications by the time their condition's diagnosed. So I think it is important that everyone is aware of diabetes and has a think about whether or not they could be at high risk of developing it.
So how serious is diabetes?
Diabetes is a really serious condition. Diabetes is the main cause of blindness in people of working age in the UK. It's a major cause of lower limb amputation, stroke, kidney failure and heart disease. In Salford, nearly 12,000 people have diabetes, and diabetes is responsible for more than 100 premature deaths every year in Salford. Diabetes costs the NHS £10 billion a year, and that's 10% of the total NHS budget, and 80% of that spend is on potentially avoidable complications.
So if we're all at risk of type 2 diabetes, what can I do to avoid it?
You're more at risk of getting diabetes if you are overweight and have a large waist. There are other risk factors that we can't do much about, such as our ethnicity, our age, and whether or not we have a family member with diabetes already. But I think everyone can make lifestyle changes. You can get down to a healthy weight and maintain a healthy weight by taking a healthy diet and having regular exercise.
So for people who already have diabetes, what should they be doing?
If you already have diabetes, it's really crucial to monitor your health and make sure that you don't develop the complications of diabetes. You're entitled to a series of checks and care from your healthcare professionals. Make sure that you go to all your appointments and make sure that you understand your diabetes. The diabetes specialist nurses run a series of education programs, so ask which one is right for you. Go along, learn about your diabetes, meet other people with diabetes, talk to them, and perhaps have a look at the Diabetes UK website, which gives you lots of useful information. Really take control of your diabetes and take control of your future health. Don't let diabetes take control of you.